Ladies and gentlemen, welcome to Kudla Vibes and welcome to an exclusive episode on heart attack. As you know, of late, the incidents of heart attack are on rise, and this has been attributed to various factors such as the passive lifestyle and excessive use of cell phone. But what is the fact? Is it a mere media hype or it's a reality? We are going to find it out in our exclusive interview with Dr. Yagnik Mukund, who has come all the way from Mumbai. He's a senior cardiologist at Holy Family Hospital, Mumbai. Doctor, welcome to the show.
Thank you for that introduction.
Doctor, as I already told you, the incidence of heart attacks have been on the rise. Now, do you think this is just a media hype or it's a fact?
Let's start off with saying that's a fact, okay? And then we'll break down why the incidence of heart attacks is on the rise. Commonly, in the past, heart attacks used to be a disease of old age, or at least older age, beyond the age of 50. But nowadays, we're seeing a trend wherein the age group of heart attacks is decreasing, although the ones that are, the old age group continues to remain the same. So younger age groups sort of add on to the prevalence of, heart attacks or patients with heart disease. The reasons being there are multiple factors that can contribute to this. One of the main important factors is urbanization. With urbanization, we tailor our everyday needs to the urban society, and that includes inactivity, availability of, opportunities and availability of things that can alter the course of your health. So, and it's a general mindset of the urban culture, at least in most urban cities, if not all, wherein, like we were discussing before the show, this is a world of excess. We live in a world of excess. And that immensely contributes to, putting younger people at risk for a heart attack. And these are the main reasons. And of course, in the recent past, COVID has changed the course of diseases per se, but heart attacks or heart diseases in particular over the past, half a decade.
Okay, Doctor, you mentioned about COVID. Now, there's a conception that increased incidence of heart attacks should be attributed to COVID and vaccine. Do you agree with that?
So interesting that you brought that up because COVID, as everybody knows, was a tumultuous, sort of period for everybody. COVID, the infection per se, in any infection for that matter, there is a general inflammation within the body. And COVID increased the inflammation to an extent where, the body had to protect itself in various forms. So through the dire consequences of, all of these actions that the body took, in response to an infection like COVID, this led to, sort of blockages developing within the heart and rest of the body and, sort of affecting pretty much all the organs. So COVID definitely changed the, sort of course and prevalence of heart attacks or patients with heart disease. On the other hand, the vaccine, well, at that point, we had to bring out the vaccine in haste because we had to protect who we could protect. Vaccine typically takes years of research, starting from developing from which protein you're going to, whether it's a killed vaccine or a live vaccine. And from there on up to the point where how do you deliver it? Whether it's oral, whether it's intramuscular, things of that nature. In this case, we were hasty and rightfully so because we had to protect all of us.
That was the priority at that point of time.
That was a priority. So in the making of or prioritizing that has led to, sort of us skipping a few steps in delivering the vaccine. And there have been anecdotal reports of adverse effects of the vaccine, which included heart attacks as well. Yes.
Okay, doctor. Now, earlier, as you mentioned, the older people used to fall victim to heart attack. Yeah. But of late, children as young as 8, 10, and the college-going youth are falling victim to it. What could be the reason?
I would say that in adolescents and in children less than the age of 15, the incidence has probably remained the same. What has changed is our reach or outreach, wherein, before 50% of a population of a city or a town or a district or a state or a country for that matter had access to healthcare, immediate healthcare. Whereas now it's probably increased to 80% or 90%. So the more you increase the scope or do you expand the scope of your healthcare delivery, naturally the numbers are going to sort of rise in terms of prevalence. At the same time, there is also dispersion of information, which is a lot more easier now than it used to be before. We are able to hear about things that have happened sort of millions and sort of thousands of kilometers away, but also just in your same neighborhood, in the same sort of depth, right? And in children and in younger adults, or I would say less than 18 years, the incidence has probably remained the same. But again, there has been contribution of urbanization to that population also, because we learn most from our parents, right? And that kind of, that intelligence sort of moves on to your children. And so that has, sort of significantly influenced, child health in our society.
Doctor, recently, news has been doing the rounds that children are falling victim to heart attack due to excessive cell phone usage. What do you have to say about it?
Cell phone usage per se does not have any bearing on or increase your risk of heart attack. But again, it is the situation surrounding the excessive use of a cell phone, which includes inactivity and your dependency on the phone for entertainment. So cell phones per se would not increase your risk of heart attack, and that is absolutely a myth. But I was reading that particular article that you've been quoting, which also says that cell phone use in smokers and in diabetics increase the risk of heart attack. Whereas smoking and diabetes are independent risks or risk factors for heart attack, I wouldn't see that as a sort of reasonable comment to make, especially for something this grave.
Doctor, now what are the general risk factors for heart attack?
So, as Indians, India is the diabetic capital of the world. So, diabetes is a major risk factor. And this is something that can be treated, can be recognized early and treated. So, diabetes is a major risk factor in India. Smoking, of course, and use of tobacco in various forms. Smoking is a more urban, sort of habit. Not necessarily, but still is. And of course, tobacco is consumed in various forms. So that absolutely is a major risk factor for heart attacks. Hypertension or high blood pressure is a major risk factor. And these are things that we can control or we can change the course once we identify this early. The things that we cannot change are, of course, age. So age is definitely what we call a non-modifiable risk factor. Lack of exercise or lack of physical activity can greatly contribute to increasing your risk or alleviating your risk for heart attacks. Primarily, of course, because the body is, sort of trained to be active majority of the time, but also it decreases your chances for developing hypertension, or at least delays the onset of hypertension, delays the onset of diabetes in patients who are otherwise prone to these sort of diseases.
Doctor, we have made a lot of advancements in the field of medicine, especially in diagnosis. So instead of waiting until we get a heart disease and then going to the doctor, is it possible to identify the possibility of developing this disease at least a few years ahead of it? Because this is what I read in the newspapers. Heart attack doesn't happen overnight. Disease would have started long back. It's a symptom that is shown now.
Absolutely. That's a very good question. So to answer that, first and foremost, it's important for us to identify people who are at risk for heart attacks. Patients who have diabetes, blood pressure, who have history of smoking, obesity, and of course, most importantly, family history. Patients who've had first-degree relatives who've had heart attacks at a much earlier age than what you would now normally consider as old age. So identifying these subset of population is important. And then we can subject them to various tests and modalities, and sort of extract the best information for us to understand who needs to be on medications, who needs to be left alone, and who needs anything more than medications. And this is what I commonly hear. People are more health driven now. For someone who does not have any of the risk factors, what do we do? In India, we recommend that men over the age of 35 and women over the age of 45 should at least once over the course of the next 5 years should undergo a screening test to identify risks for heart attack. And one such screening procedure, we have various such screening procedures, starting from a basic ECG to a treadmill test, wherein we walk on the treadmill and we monitor the ECG changes while you're exerting your heart, up to the newer modalities like coronary calcium scoring, wherein the CT machine picks up the calcium deposits around the fatty plaques, is what we call it. So we have available with us, sort of a variety of tools. It's important how we use it and on whom, because the information that we get from that needs to be always corroborated with the patient and the patient's profile in terms of how what are his risk factors, if he falls under a high risk, medium risk, or a low risk category.
Okay, doctor. Now, what are the typical symptoms of heart attack? How does it start? Because often people have a confusion. Even if they have little chest pain associated with gastritis, they tend to mistake it for heart attack. So, what are the typical symptoms of heart attack? And when you develop that, how should you respond to it? What is the first action that you should do?
That's very intuitive. So, the typical symptoms of a heart attack are chest pain. Now, the chest pain in general is, you feel like, commonly we say there's a big boulder of stone sitting on your chest. It's a crushing type of pain. It's a heavy sort of pain. It's always associated, or more commonly associated with, sort of sweating during that time. These are the more typical symptoms of, sort of heart attack. The chest pain can, sort of radiate to the neck, to the jaw, to the back, to the left arm. And uncommonly, we also encounter patients who don't have any chest pain. 20% of heart attacks in diabetics are without chest pain. And they experience, sort of unusual symptoms. For example, they just feel breathless, or they feel fatigued or tired, especially, older women. They experience heart attacks slightly differently than what we conventionally understand heart attack to be. But the more common symptoms are chest pain, which kind of can move to the neck, move to the shoulder, move to the back, and usually associated with some sort of pain. Now, the second part of your question, what do you do at such a point? The first thing to do is to get an ECG. ECG is a tool that has not changed for 125 years. It was, first discovered or invented by Einthoven back in the late 19th century. And it hasn't changed because it hasn't needed to be changed. So the first thing to do is to go to your nearest, sort of clinic, dispensary, hospital, and identify that it is a heart attack. Because once we identify it as a heart attack, then we can take the meaningful next steps, be it, with medications, or be it, going to a higher super specialty center for whatever intervention that they want to perform. So the first thing, like I said, is to get an ECG, identify that it is a heart attack, receive, first aid or first line of treatment there, and then proceed from there on.
Okay. Now, doctor, the incidence of heart attack now being reported among school-going children and adolescents. In this scenario, do you think even the children and the youth need to go for screening?
The screening process for children and the youth, when you say youth, I'm assuming you mean anybody who is less than 18, or school-going children and very, very young adults.
Yes.
It would be a huge undertaking on our part to be able to accommodate screening process for children, especially because the rarity of heart attacks in children. I don't believe that there is an increase in heart attacks per se in children. Like I said, like we discussed a little earlier, I think we've increased the scope of the number of people who receive healthcare in the country. So obviously that is going to add to the prevalence of any disease. But I don't advise kids or any healthy kid or young adults or youth
Going for screening.
going for screening. Yes.
Okay, if that's the case, people of what age group should go for heart screening?
We are talking about age being an independent risk factor. If we treat age as a risk factor, then we got to account the other risk factors as well in terms of diabetes, blood pressure, kidney diseases, smoking, obesity. You take in all of these risk factors and you add age along with it. Anybody less than 35, unless they have one additional risk factor, I would not subject them to a screening procedure. Simply because the alternative is that we increase the burden of sort of screening all of these, anyone between 18 and 35. We sort of increase the burden of screening. So it would not make sense for us to screen anybody between that age group unless they have one additional risk factor.
Now, doctor, I heard that in Mangalore Heart Scan Foundation, there are some advanced tests which would help you to identify whether you have a risk factor for developing a heart attack in the near future.
Yes.
Could you elaborate on that?
Sure. So at Mangalore Heart Scan Foundation, we offer a screening test called coronary calcium scoring, which I had mentioned a little while earlier. It basically identifies specks of calcium deposited within the fatty streaks, what we call, or plaques. That's what basically narrows the lumen of an artery in the heart. They sit on the inner walls of the artery, the cholesterol plaques. And the body tries to sort of stabilize that by also calcifying it. And identifying those calcium specks can, sort of greatly enhance our treatment of patients who are at risk for heart attacks. Because based on the calcium score from the coronary calcium test, which is basically a CT scan test, we are able to identify patients who are at risk and either put them on medications, recommend anything more, or just leave them alone.
So, doctor, as we come to the end of this podcast, doctor, could you please give our viewers a few tips as to how to prevent heart attack?
Absolutely. So, few things to keep in mind. One is, of course, to have a reasonably healthy diet. Diets can change from region to region. So, whatever is within the purview of our region, any reasonable healthy diet, should be something that we should, sort of inculcate in our everyday lives. Identifying if we're at risk for heart attacks by the tests that we were talking about, diabetes and blood pressure, identifying if we have family history of heart attacks, and obviously being physically active in any form, anything that you can enjoy, be it a sport, be it a dance, be it any sort of physical activity, like more importantly, which you enjoy, because that in itself can do two things. One, keep you physically active, and second, decrease your stress levels. Because again, stress over time can influence. Stress for a short period has less adverse impact, but over a period of time can have, sort of adverse influence in a way that is not necessarily something that we want. So these are the few tips that I would give our audience.
Thank you, doctor, for enlightening us about heart attack and how to prevent heart attack. Thank you so much.
Thank you, Mr. Andrew, for having me.